Hi, my name is Penny Rodriguez, and thank you for joining me tonight to discuss the importance of type 2 diabetes as it affects many here in Washington State. I'm currently a Doctorate of Nursing Practitioner student at Gonzaga University and have had the pleasure of working in the long-term care industry in Washington State for over 20 years. I currently serve as a registered nurse and see diabetes affecting hundreds of thousands of people here in Washington State. The CDC in 2014 discusses the importance of this epidemic in a report entitled the Washington State Epidemic Report on Diabetes. This report supports the Department of Health, the Healthcare Authority, and the Department of Social and Health Services here in Washington State, and requires them and encourages them to work together to come up with a proposal to better support and reduce the incidence of diabetes. Diabetes is on the rise with over 1.9 million new cases reported annually, and there's no slowing it down. There's a reason they call it epidemic, and in particular, the Hispanic population is more than 50% more affected by the disease. The Hispanics also have to deal with financial considerations, cultural considerations, healthcare education literacy, and lack of insurance. Not only is this population on the rise here in Washington State, but the lack of support for individuals at the clinic level to help educate them on the prevention of this disease has definitely reached an epidemic proportion. I'm proposing to ask you to support through funding and support of the agencies involved to get more educational groups available for the Hispanics so they can further understand the disease in hopes of reducing the incidence of A1C levels, lipid levels, blood pressure, reduced blood pressure, more increased physical exercise, reduced BMI, and reduced tobacco use in relation to many other comorbid conditions with diabetes, so that this disease can finally become on the decline instead of on the increase here in Washington State. With your support, through funding and through education, we can get a handle on this disease here in Washington State, and I look forward to working with all of you so we can see generations of healthier Washingtonians. Thank you for your time and support this evening, and I look forward to bringing more information to you in the future.